Good evening. I'd like to get this meeting underway. I'm Commissioner Denny Bucher, and I want to welcome you all for being here. We appreciate you coming. My role is very short. I'm all done. I just need to introduce Caitlin, who's going to come and take over. Caitlin, come on up.
Hi, everyone. Thank you so much for coming tonight. I'm going to try not to bore you to death. So hopefully it's interesting. Hopefully you learned something that you didn't know before, and you're able to leave this meeting feeling like it was beneficial and useful, and that you know who to contact if you have questions or suggestions for opioid settlement funds. So the purpose of this meeting is basically twofold. So we want to ensure transparency with the funding, what we're spending it on, how we reach those decisions, how you can contact us to learn more, how you can have input, not just here at these meetings annually, but throughout the year, because your voice is extremely important in how this funding is utilized and the steps we take and the progress we make. So, of course, the input for this meeting, we want to focus on that tonight and try to ensure that everybody who wants to speak and give input has an opportunity to do that. So my goal is to keep this short and sweet on my end so it gives you the opportunity to say as much or as little as you would like to. So first, we're just going to start with some data. In your handouts, you have the full report of the SUITRS report, which stands for the State Unintentional Drug Overdose Reporting System. I'm just going to hit a few highlights that I think are important, but like I said, you have the full report, so you can look at that in further detail. So the Craven County resident death rate decreased by 46% from 2020 to 2024, compared to a 16% decrease among all North Carolina residents for the same period of time. Now, yes, this is based on the 2024 data is the last data. That's because the 2025 data hasn't been finalized yet. So more of that will be coming hopefully within the next 6 months as the medical examiner's office finalizes toxicology, autopsy reports, all of those things that they want to ensure is accurate before they start building this type of outcomes and information. You'll notice that over to the right-hand side of that goes into some demographic information that I think is important to highlight there. So as of this, or with this data, the highest overdose death rates occurred among those who were male, white, and aged 35 to 44. So that's a key piece of information as we go through the next few bit of data, because you're going to see a shift in some of that as we're getting the newest data from 25 and 26, even though that's preliminary. So this is the Craven County fentanyl positive deaths as of February 2026. Like I said, the asterisk next to 2026 indicates that this is preliminary or provisional data. So these numbers could change as more confirmation information comes out. But it's still very useful for us to be able to make decisions that are more timely. So we're not always reacting 2 years after the fact. So this is a great way for us to get trends and catch things before they get too far beyond what we can actually step in and have an impact on. In your packets, you have the statewide report for this. Up here's the Craven County, but you have the statewide. So if you'll notice that the fentanyl positive deaths for Craven County for 2026 was the same, or for February, January to February, is the same. So there were two month-to-month comparison between the 2 years. So we had two. Not bad. Didn't go up. It's just the same. So it's just these reports draw that month-to-month comparison over time. Sometimes that will help us figure out where trends fall within the years. So there are times in which, especially summer times, where we tend to see higher rates. And so having those monthly reports helps us kind of track that as the data comes out and as we look at these reports to have useful information before the finalized data comes out. You'll also see to the bottom left, that bar chart. You can see that decrease trend over time. all of which is a great sign when it relates to fentanyl positive deaths. So the next report, again, you have the statewide report, and the one on the screen is for the Craven County Opioid Overdose Emergency Department visits. So again, same number as last year for March as it was for this year for March. So 9 visits. Again, you'll see in the bottom left-hand side that fluctuating, much more fluctuating than the last data set was, but still a steady decline since 2021. So that's great progress. Everybody in this room has had an impact on getting that progress and making those efforts show in these reports. The other important thing to note is now I've just shown you 2 reports where there isn't a decrease in the numbers in a month-to-month comparison. If you're a data nerd like me, I have the affinity to get worried when I don't see a decline. I want to see the numbers moving. I don't want them to see them go up, but I want to see them going down. And for Craven County, we're very used to seeing those numbers go down. So the fact that we've got 2 back-to-back reports like this that have the same month-to-month comparison where the numbers aren't changing, it's not a reason to get worried or panic, but it is an indication that we need to pay attention and kind of look further into the numbers and look at different numbers and see if there's a trend that may be reported in other factors that we can pay attention to and factor in when we're trying to make decisions based on the or close to real-time data that we're getting. So page 2 of this report breaks down the demographics. So this is where I mentioned the trend as opposed to the suitors data that we looked at on that first report that I showed you, and you have the full report of the suitors data. It indicated that the highest overdose deaths for Craven County were for white males. This is not comparing apples to apples, so it's not a direct comparison, but it is an indication because we know that individuals who have experienced an overdose and survived are much more likely to die of an overdose. So there's that linkage there in the reporting and the metrics that you can really try to draw, or you can start to draw some conclusions that there may be a shift coming in those demographic areas and those target populations that you want to focus on. Because this is showing that there's a higher percentage of Black individuals, Black males, that are reporting for ED visits as a result of an overdose. We have seen that trend also in other reporting measures and other outcomes. So that seems to be a shift that is occurring, that the shift is now shifting from white males to Black males. So that disproportionate demographic population, that's going to be a key area for us to keep an eye on and make sure that we're not overlooking that as we move forward and as we make decisions about funding. So this report, a little bit different as far as the format. And this is a report that starts to get a little scary for me. As you can see, it's been quite some time since we've started to see an increase in overdose death rates for Craven County. We had a substantial decline in deaths, in overdose deaths from 24 to 25. So especially in comparison to the state. So Craven County's decline was about 65%, whereas the state was around 35%. But now we see the trend, now we're an increase by 38.4% in overdose deaths. So you take into account that other information and the more up-to-date information of the reports that we just looked at, where the numbers haven't declined, they've stayed the same, and now you see this increase in overdose deaths, definitely starting to raise a little bit more of a concern. And it indicates we need to dig deeper. It's not that we're doing anything wrong. It's not that you scrap everything that we've done and we start from scratch. It's we have to get more focused, targeted populations, focus on where those vulnerable individuals are, and making sure that we're really focusing on those targeted efforts and not overlooking those individuals. So, opioid settlement funds is how we do that. So, I want to go into detail again, trying not to bore you to death, and I apologize if you already know this information. But I do want to give you a general overview of where the funding came from, what the funding is exactly, so then we can get a better understanding of how we can use this money in order to target these vulnerable populations. So the opioid settlement funds were a result of legal actions against pharmaceutical companies, manufacturers, distributors, pharmacies, some of the big named ones that you've heard of all the time: CVS, Walgreens, Purdue Pharma, Janssen or Johnson & Johnson. So all of those individuals were part of these settlement funds. These were targeting those companies because of their deceptive marketing, them downplaying the risks associated with opioids, and failing to monitor the suspicious activity that was occurring. So as a result of that litigation, and after years of legal proceedings, the companies agreed that yes, they were liable in some shape, form, or fashion for the various ways that the opioid epidemic came to be. So they agreed to settle. That's where these funds came from. The purpose is very specific with these settlement dollars. Because of the nature of them, because what their actions resulted in, the purpose is specifically for remediation or abatement, which is just a fancy way to say to treat, to fix, to mitigate. In total, these settlements resulted in just over $50 billion to be dispersed nationally. That's 1.4 approximately billion dollars coming to North Carolina, and just over 16 million coming to Craven County. So that's the money that we are working with. So the North Carolina Memorandum of Agreement is a legally binding agreement that directs us how we can spend the money and how we have to spend the money. The only things we can spend the money on, those are outlined in the NCMOA. So one of the key things that I want to point out here is that it specifies within that document that all opioid settlement funds shall be utilized only for opioid remediation activities. It sounds very narrow. It sounds very specific. And in some ways it is. In other ways, you have to understand that the opioid epidemic has so many ripple effects and has impacted communities on so many different levels. And so it involves so many different factors. So there are a lot more ways that we can use the funding that is still related to and still focused on opioid remediation. The authorized remediation strategies are outlined in Exhibit A and B of the NCMOA. In your handouts, you have a copy of Exhibit A directly from the NCMOA, so you can review those. These are referred to as high-impact opioid abatement strategies, and they mean just how they sound. It's the high-impact hitting ones. It's the more bang for your buck, so to speak. I also like to think of them as the direct impact strategies. These are the strategies that were determined we're going to have the most effective impact on the individuals directly related to and directly close to the opioid epidemic. Exhibit B is a little bit different. The NCMOA refers to them as additional opioid remediation activities. That doesn't mean that they're any less important. It just means that they're more indirect. Their effect and their impact is not going to be as substantially large or noticeable even as the strategies under Exhibit A. In saying that, in order to authorize Exhibit B strategies, counties have to go through a collaborative strategic planning process, which is where they develop a report and they submit recommendations to the Board of Commissioners. And they have to have reasons in this report that substantiate and justify why a strategy or multiple strategies from Exhibit B are so important and so necessary for that community itself. There are a lot of strategies listed under Exhibit B, hence why you don't have a copy of that. There are pages upon pages that go into more broader category of strategies for Exhibit B as opposed to Exhibit A. The majority, if close to all, but a lot of them can be covered in some ways under Exhibit A. And if you're really looking at high impact ways to change communities and to change our county, those in Exhibit A are really where you want to focus your efforts. There's only been one example that has stood out as a gap and a need for Craven County that does not fit under Exhibit A. And that is primary prevention or prevention. Primary prevention is everybody gets it, regardless of risk, regardless of impact from opioid use, regardless of socioeconomic status. Everyone gets it. Everyone gets the same thing. So there are multiple different curriculums, school-based curriculums especially, that focus on that primary level of prevention. It's not that it's not necessary. It's not that it's not important. It's just an Exhibit B strategy because it's not directly related to abatement and remediation efforts. So approved uses. There's no amount of time that I could ever explain or go through all of the approved uses for opioid settlement funds. So I've broken down into more of like focused areas or focus areas of categorical ways that are typically responsible usage of the funding. So basically it focuses on approaches that are proven to save lives, help people get the care they need, and make communities healthier. So this is not just substance use treatment as far as care. This is also primary care services. Individuals with substance use disorders have a lot of health conditions, and the majority of them do not focus or really prioritize those health conditions. So it's imperative that you focus on connecting those individuals to care of all kinds. So the focus is also on long-term effective solutions, policies that are grounded in evidence and supported by experts and research, especially when it comes to evidence-based treatments. With evidence-based treatment in the world of opioid use disorder, the gold standard is medications for opioid use disorder, which are the 3 FDA-approved medications: buprenorphine, methadone, and naltrexone. So what's not approved? What's not recommended? What can't be funded with opioid settlement funds? The first one on the list, I think, is one that we struggle with ourselves, is that abstinence-only drug treatment programs, because there are so many out there. It's not to say that it doesn't work for a lot of individuals in recovery. It's just not an evidence-based treatment, and it does not show effective outcomes. In fact, research shows that abstinence-only drug treatment programs have worse outcomes than no treatment at all. So you would be better just not trying to engage those individuals in treatment if the only thing you're going to offer them is abstinence only. Also, programs or modalities that are not supported by evidence. So it's not hoping it away, it's not wishing it away, it's not wanting it to be better if you just do this. It's not a moral thing, it's not a spiritual, religious-based thing. It really has to be supported by evidence for it to be covered with opioid settlement funds. Other prohibited uses are related to initiatives, programs, or activities that perpetuate or promote further criminalization or incarceration of individuals that use substances. And we also can't use it for supplantation of programs, activities that were already being funded by another mechanism. So it's not meant to replace funding that we already have in place for a program. It's meant to supplement, meant to improve, expand, build upon, make it better, and find ways that we weren't able to find before because of lack of money to enact and make those programs more effective and reach a broader range of individuals. Unfortunately, you can find real-world examples from all over the country of problematic spending. And they're occurring right now. They're still in place. We just don't want to be on that list. We want to be good stewards of the money, not because we're afraid of the blowback of the state. Granted, we don't want that. We are afraid of it. But we want to do the best we can with this money to help the individuals that have been impacted. We want to use the money responsibly because those individuals are important and they matter. It's a public health issue. It affects all of us in one way or another. So, our funds at work so far. So, the fiscal year 24-25, so last fiscal year, here's just some highlights of the outcomes from the programs in which we funded, the strategies that were approved and funded. So, our post-overdose response team that's run through Carolina East Foundation engaged 98 participants, had 405 contacts, so individual contacts and follow-ups with those individuals. Distributed 407 naloxone kits and referred 51 of those individuals to harm reduction services. Through recovery housing support, 17 individuals were served, which doesn't sound like that many, I know. But that equated to 2,436 nights of stable, safe, recovery-oriented housing, which is so important with a population that is often unhoused, has very unstable housing, and housing just in general that just doesn't support them getting any better. So that's essential. We want to expand on that. And we want to make that number larger. We're working on it. And through our Opioid Epidemic Response Department, we distributed 700 naloxone kits, and we interacted with approximately 1,600 individuals through just community outreach events. So if you aren't familiar, we are a department of two. It is me and the outreach coordinator, Ravella. So to touch that many people through community outreach events is pretty awesome. I think it's awesome. But we also want to expand on that too. We don't want to stop there and say, oh, that's great, that's enough. We want to keep growing that. And we want to make sure that everyone in the community knows how to find us. We don't have to go to them, but we love to go to them. We love to get out of the office. It's so nice to go to community events and see the rest of the resources and interact and network with individuals and really remind ourselves the reason in which we're doing what we do every day. Seeing the people, interacting with the people, being one with the community. So the current funded strategies, very much the same as the 24-25 strategies. So collaborative strategic planning, which is done through the Craven County Opioid Epidemic Response Department. Our post-overdose response team, like I mentioned earlier, was through the Carolina East Foundation. Recovery housing. Our partner in that right now is the Healing Place of New Hanover County. Unfortunately, this year, we lost one of our recovery housing partners or subrecipients. So we've been working hard to find an additional partner to contract with and making sure that when we do sign contracts with that other provider, that it's a good, strong, stable provider. And prevention. You'll notice there are asterisks next to this one. That's because, as I mentioned earlier, Exhibit A does not include prevention. We funded the Too Good for Drugs school-based curriculum in all Craven County schools starting this school year, so starting last August. I included that on the list because it was still technically funded with opioid settlement dollars, but it was a separate settlement, so to speak. It was a class action lawsuit, and it wasn't the same, and it isn't governed by the NCMOA. So we were able to use that funding, that additional funding, for prevention. So we got that school-based curriculum into the schools, and I've heard great things about it. I would personally love to sit in the classroom and see how they do it, but I'm not a kid anymore. And so, but I'm just glad that we're getting some positive feedback from not just the individuals in the schools that are teaching it and facilitating the curriculum, but I'm also hearing great things about how the students are reacting to it and how engaging it is. So that curriculum itself was implemented in first, third, fifth, seventh, and ninth grades. So it won't be just a one and done. They'll get it throughout their school. So planning for the future. So this is where we really focus on turning that data into action. And this is how we make these decisions of where we want to spend the money, where it's important, where the impact is going to be. If you look back at that suitors report that you have, this is a section that I think is extremely important in that report because it already starts identifying some of those vulnerable populations. These are the vulnerable individuals that you want to target. This is a flag, just waving, saying, here I am. These are the people we need to focus on. These are the ones that need the most help and the most attention. This is where we can focus more of our efforts, be more intentional with the funding decisions that we make. So people experiencing homelessness, people who have had involvement with the criminal justice system. Those individuals are 40 to 50 times more likely to die of an overdose within the first 2 weeks that they're released from a detention facility or prison. So that's a key population that really indicates they need a lot more attention, and we need to target our efforts there. Also, we're in between huge military bases. Military veterans are a high target vulnerable population as well. Also on that suitors report, the graph shows other vulnerable populations to focus on. So individuals that also have a mental health diagnosis, that have previously overdosed, that have ever been treated for a substance use disorder, not just an opioid use disorder, but any kind of substance use disorder. As we mentioned earlier, recently released from an institution and have been receiving treatment for pain. So all of these areas are just ripe populations for us to really focus our efforts and target those specific individuals. That's where we want to build and be guided. We want to be guided by the data. So with that, these are some of the strategies that we've recommended moving forward for fiscal year 26-27. The first four, you'll notice, are the same ones that we are currently implementing. The fifth one, naloxone distribution. We want to really focus on expanding naloxone distribution and focusing on those target areas that we haven't really been hitting. How can we get into those in connection with those more vulnerable populations? How can we get in front of those individuals? How can we reach them and ensure that they have ready access to naloxone so that we can cut down on those overdoses and those deaths? Reentry programming. We want to build up those programs and make sure that those individuals are prepared that when they leave a carceral setting, they have the best possible opportunity to become productive members of society and to not return to jail. And criminal justice diversion programs. We want to build those up, divert them from jail for those individuals that need treatment, remove them from the jail system, and try to connect them with those treatment services instead of repeat the cycle of recidivism. That's where we're projecting and we're recommending that we focus our efforts for the upcoming fiscal year. But the work doesn't end there. So through our ongoing efforts with Recovery Alliance Initiative, we already had a regional task force focused on transportation, and we've recently launched 3 additional regional task forces that focus on recovery housing, treatment and stabilization, and care management and care coordination. So we really want to focus on those areas. Those are the top gaps and needs that have been identified through the regional gaps and needs survey. And so we really want to focus on getting individuals from the community in those task force groups, coming up with solutions, developing proposals, and then bringing them to the advisory committee members to put those proposals into action. Boots on the ground in the task force saying, this is what's needed, this is how you can do it. And then the advisory committee being the glue, so to speak, this is where we can get the funding. This is how we can put those pieces together and make this work and put it into action. So that's how that regional collaborative is structured, and we're very excited about that. I know I'm a nerd. You don't have to be excited about that like I am. I hope you're excited. If you are interested in joining a task force, please let me know or a member of the REI team know, and we are more than happy to have you. But you don't have to join a task force in order to have your voice heard. That's one of the things we want to, get into tonight. We want you to share with us, and we want you to realize that we really do want your input, and we want to know what's important to you, because this is your money. This is your community. We need you to help us figure out where it needs to be spent. And with that, I'm going to turn it over to Jack White.
Okay. Good evening. I'm Jack Veit. It's a pleasure to be here tonight. This is the time for you all to share with the county, Caitlin, our team, our collaborative, items that you've heard about tonight that interest you, needs that are out in the community. And this is a little unusual for me because I'm supposed to listen tonight and not talk. Normally I talk and don't listen. I'm accused of that at home all the time. So I'm going to try real hard tonight. But Shane's going to be walking around with a microphone. We want to hear from you. I mean, the purpose of this meeting, this is ultimately your input, helps build our program and make it better. So Shane, if you'll just start walking around. Yep, that's a good place to start right there. Yep. Very good. I know people's names in here too, so.
Jack, I'll just ask you, how much is the proposed budget this year for this program?
Caitlin may have to have her microphone because I would have to rely on her for that. That's okay.
Proposed so far that we've put in front of the Board of Commissioners for the 26-27, it's running about $750,000, I believe was the last number for that. I can get you the specific numbers if you want. Okay.
Tyler, remember, there's other funds in the budget related to this issue. So Scott Harrelson, you got anything? Nope. Moving on.
He doesn't want to. So of 750, what is that as the proportion of what was allocated for the year or estimated for the year? I remember, if I recall correctly, the 16 million was over 18 years, and there was an estimated spend rate or burn rate for each year.
Yeah. No, that's fine. I'm going to hand to Caitlin here for the.
So are you asking how much we have left remaining?
I kind of remember seeing a chart that had like a little bit more than a straight line expenditure for the first year or two, and then it was pretty much a straight line for the rest of the 18 years. What was that number? Was it 850, 900,000 a year?
Oh, that graph is the disbursement to the individual counties. So it's front loaded so that the individual counties are dispersed or the funds is distributed directly to the counties in the highest amounts for the first few years, and then the amounts just taper off. That doesn't mean that we have to spend it at that rate.
Got it.
It's not going to run out. It's not going to expire. It's not like we have to use the funding by any certain deadline. That money, once we get it, we still have to use it for what's outlined in the NCMOA, but there isn't a deadline for when that's spent.
Okay, got it. I guess the reason behind the question was like, is 750, is that representing about what you guys were expecting to spend this year? Are you looking for some more great ideas?
We're always looking for great ideas.
Sure.
And the great thing about it is that throughout the process, we've really learned a lot about how simple it is for us to adjust the local spending authorization and take it in front of the Board of Commissioners, let them know what we're working on, explain the programs, explain the additional providers. And it's a very simple process. Once we get the approval from the Board of Commissioners, we're ready to spend at that point, and we just have to share that information or upload it to the state's site.
Got it. Another question about the last bullet point, talk about criminal justice diversion program. I'm familiar with the recovery treatment courts or the recovery courts. What are their opportunities, or what are other counties that don't have recovery courts doing as far as diversion programming?
That varies greatly depending on the county and depending on if you're looking at a detention center versus, of course, a prison population is going to be much different. One of the things that Craven County Detention Center, started out and is still working towards getting that back up and running, since we lost the housing provider that was connected with, was screening the individuals once they are booked into the detention center for those substance use concerns, as well as co-occurring mental health concerns, and focusing on getting them assessed, having recommendations established for what those needs are for those individuals, and then connecting them to peer support specialists within the detention center for them to really get an understanding of where their needs are, and if those providers, those recovery housing providers on the outside, are able to meet those needs for those individuals. And then it involves, of course, coordinating with the court system, and making sure that those individuals have specific charges that are not going to put the community at risk if they were to be able to be released on EOMP or electronic monitoring, to be released to those programs. So it's kind of a dual focus. You want to divert those individuals from jail because we're spending a lot of money on them and they're not getting the services they need. So you want to ensure that you're using the funding that you have the most effectively and still helping the individuals that need that help.
Got it. And it's only for diversion from incarceration, and not more of a wide spectrum of diversion from maybe more severe sentencing for even people that aren't incarcerated. That's kind of where I'm wondering where there's opportunities to encourage somebody to accept, a shorter probation term as long as they're doing other things in recovery-related things. Somebody who might not even be looking at incarceration, but still is involved in the criminal justice system.
Right, and there are different types of diversion programs as far as the pre-arrest diversion and post-arrest diversion programs is typically those diversion areas or programmatic structures that you're looking at when we talk about diversion programs.
Sure.
And that really varies depending on the structure of, or the court system and the district attorney's office and the sheriff's department. It takes a lot of coordination
Right.
between multiple different departments to get those things in place. But there are different things, different counties are doing those diversion programs such as LEAD, law enforcement assisted diversion, and that's a more of a pre-arrest, pre-trial diversion program. But there are a few different models that are possible with the funding.
Right.
And we're more than happy to listen to anyone that has a proposal and an idea, a suggestion for us to adopt something like that. But we would just, all it takes is a conversation, and then we get the right people in the room to see if we can carry that conversation and make that into more of an actionable plan.
Right. Got it. Thank you.
Thank you.
Thanks. Hey,
Hey, Caitlin kind of stole my thunder, but I don't have a question per se, but I just want to say thank you to the county for this meeting and also working with us. We are actually working with the Craven County Jail, and that program that she spoke about is really, really off to a great start, and it has been working very well over the past 2 years. And so we have been in conversation over at Journeys to Success. We've been in conversation to try to find that enhanced sort of treatment focus, so like residential. So for the most part, once we do the screenings, the intakes, we make sure that our clinicians do understand what's going on as far as like the co-occurring disorders. Then they are connected with peer support. From the peer support, we're working to incorporate a reentry coordinator within the jail, because that person will, for the most part, speak with you all in the community for community-based services. So if that individual meets or passes through the risk assessment with electronic monitoring, then they can be a part of society. So I just want to say that, the county is working exceptionally well to get these services expanded, and we're very appreciative. Thank you.
thank you. And she's being modest there. Dr. Harrell has had a lot to do with the success of that program, so thank you for what you do as well. Okay, I know people's names in here. Just looking around the room. Scott, you want us to come back to you now? Got it. All right. Okay. Caitlin, I guess that's a wrap. Look.
Hold on.
Oh, there we go.
Good evening, and thank you again, Mr. Veit,
Hey,
and
Benita.
all of the committee who has effortlessly, it seems like, but I know that y'all put a lot of work into helping our community. So just a couple of questions. As we pivot as a transitional home, I will definitely be getting with you, Caitlin, because we would like to be considered. One of the things that we have, my sister's house, have ran into, we were so gung-ho about being a place for reentry only, until we understood that reentry without recovery is a mess, because a lot of the recovery depends on good reentry and vice versa. They are overlapping. And so what we found out, Mr. Veit, is that we needed training. We just needed training. We've had several professionals to come in thus far after we've come into this awakening, epiphany, so to speak, that we needed. It's more than just having a good heart and passion about something. You have to have the training of the population that you are working and serving. And so what we've done since opening in 2023 is get that extensive training in opioid and in substance abuse disorder, so that we could be a house that could accept those who are recovering, who doesn't have a place to stay, who do not have a safe place to land. With that being said, we had to, of course, reach out and be creative to get the funding for the training, because you all know about grants. You can't say, well, we need money for training. That goes under operations sometimes. And so we had to be creative, and we're thankful that we've had supporters throughout the community to say, hey, we believe in your organization, and yes, we'll help you. So my question, if it's a question, what could we do moving forward in getting training, better training, and our training funded through the opioid settlement? And I see, based upon what you showed us tonight, that it's not really under the MOA Part A, but it could be.
Right. So Benita, I think you bring up good points, and I think Caitlin's statistics on who's most susceptible to another overdose, that reentry crowd was pretty high on that list, right? So it's certainly something there. I say this, that just because it doesn't fit in this box doesn't mean there's not another box it may fit in, right? So there's lots of conversations, and I think I was talking with some folks earlier about recovery housing, right? There's some beds in this program. There's some beds the county pays for. There's beds in a grant that the sheriff has. So there's all different ways. I think meeting with Caitlin and her team and talking through your issues, there may be another solution that's there for you, okay? You got it. Good stuff, though. I like what you guys are doing. Right. Shane, do you have a comment?
No comment. Great job.
All right. So look, following up there, and please stop me if you see somebody else that you think is something. Let's get it out. But this isn't the only time you can talk to us, right? Scott and his team at the health department, Caitlin, her team at Opioid, myself, commissioners, we're always interested in the programs and ideas and ways to combat this crisis. This is just the point in time we got to check the box, right? We got to get this done, but we want to continue these conversations. I want to give a shout out to Tom. It's the second time I've been at the podium. Dane, the second nice thing I've said about him, even though he didn't buy the weather package, as you can see that dark cloud out there. So Tom, that's all because of you, buddy. Next time you'll buy it, right? But the REI Collaborative, the discussions that go on monthly, now regionally, Tom, that you guys are doing. I was here today, and I see a lot of faces I saw earlier. What his group's doing is remarkable in this space. He brings in the experts, and they talk about this subject, and they provide that training you're talking about, right? And they get to the root of these. I saw, Caitlin, you had transportation there, and I see our transportation director here tonight. And I remember one of the very first things that came out of Tom's early collaborative meetings was transportation, right? How do you have somebody in recovery housing that can't get to the recovery services? And they're falling through the cracks. A lot of them don't have vehicles, they don't have a lot of money. And we found a program, there you are, that was able to look at that as a disability, right? In some cases. And we were able to tap into some unused federal funding and really get those folks the help they need. So there's all different ways, but it's this conversation through Tom and others that make this happen. So I'm looking around the room, nobody's jumping up and down to talk. So I'm going to end it there. Thank you for coming tonight. Stay in touch with us. We'll see you next year at a minimum, but we want to see you before that too. Drive safe.